Hello everyone. Hello Instagram family. My name is Dr. Neha, a clinical psychologist and psychotherapist and a speech therapist, and I am from Pakistan. Today I have this privilege to to call someone in my live streaming, to talk about mental health problem of parents who have special needs children. And thank you so much, Mir Khan, for joining me. Uh, and today our topic will be of for the parents who have special needs children. As you all know, that mental health week is coming; it's approaching very soon. Okay, okay. Sir, kindly can you let me try to join you? Can you please send me request? Okay. Hello, sir. How are you?
Good, good, good. Good morning
Thank you.
here, good evening there, right?
Yeah, good evening. Because over here we were observing the holy month of Ramzan. That's why I request you to change the time, because that was in between the Ramzan timing.
Right,
That
right.
was our iftar timing. So thank you so much, sir, for joining me. And I would like to uh, introduce you. But I would like you to introduce yourself by, because the work you are doing is very important. And as you know, that mental health week, day is also approaching on 10th April. And nowadays, because I'm a psychologist, I'm working with children and children as well. So nowadays, I'm observing, autism awareness week as well. So my all topic for this week was about autism. But when I came across
Right.
your profile, then you're working with depression and anxiety. So there are a lot of profession, a lot of professionals whom I came across during my practice. The parents are suffering very badly from depression, especially from depression and anxiety. And just because of these depression and anxiety, they're not able to take care of their children, and they're not able to take care of their self as well. And sometimes their condition is creating a lot of hindrances for the child as well. So first, kindly introduce yourself. Then I would like to tell you to tell me about your work. Then we will go to the topic straight.
Definitely, definitely. So it's very nice to meet you. My name is Alfredo Ramos. I'm a licensed mental health counselor in the state of Florida in the US. Basically, I have been working since I applied with parents and children dealing with stress, anxiety, mood disorder. Then after the process, right, with parents, with uh, to try to use the of uh, for you, the problem and part here. And before we start, you know, what things that is uh,
Okay, so I would like to inquire, but this the question came in my mind when you were discussing, but I would postpone this question,
okay.
and because that is about the parents who have special needs children, and as you know that is our today topic. So, what is the ratio? Okay, people, your clients are coming toward you when they have anxiety and then they have depression. So, what technique? Because you're a psychotherapist, and psychotherapy have a lot of you could say a lot of types. What therapy type you are using, or whether you're using elective approach or using Freud approach, the classical psychoanalysis approach. What is your approach for psychotherapy?
So when I started, I used to use a lot of psychoanalysis. However, when you're using that, it takes a while for uh, you my that was low. So when
Sir, my our listeners are saying that they cannot listen to you. Maybe they have some you have some technical issue with the net. Maybe I'm having some issue with the net. Can you listen to me, sir? Tell me. I'm asking from the listener. Can you listen us?
I can hear you very well.
Yeah. Okay. Actually, meanwhile, when you're talking about something, then the voice is cutting because I don't know, because these technology is not very you could say you cannot rely on them.
Yeah.
They can give you at any time. Today I was having 2 streams and they just canceled because of this reason.
No.
And that was just because of some with related to the important topic of autism for this year, the inclusion topic, and the workplace inclusion, and about the post-pandemic situation of the autism and the therapy situation as well. So that was creating issue at that time. So can you please repeat again what approach you are using, because at that time the net was not working. Sorry, I'm repeating my question.
Definitely. So what I was saying is that when I first began providing services, I was doing a bit more
Mm-hmm.
but with the however, where instead of putting them on a wait list, we become more focused. So with
Mm-hmm.
uh, as mentioned, which is the part of coming to
Okay.
most people that the future is not we are used to what you here,
Mm-hmm.
so that by of so it's a scary anxiety, but it definitely gives me
Okay, thank you so much for your response. And according to my own experience, is you have to know every aspect of each and every therapist, because these therapies are devised after a lot of research, a lot of working with the patient. So I also like to use eclectic approach, but you have to know the information, because every day that patient is coming to you with different set of mind. So you have
right.
to jump to the topic because we don't have that much time. Uh, I would like to you to tell me that parents who are suffering from depression and anxiety, do they come to you for therapy?
So it was cutting off. I did not understand the question. Can you repeat the question again?
Okay. My question is, like it's related to our topic as well. Do the parents
Yeah.
who have children with special needs, do they come to you for the therapies or not?
Yes. So not only those with children of special needs, but parenting in general, because
Okay.
special needs or not, the parent has the primary role of being the educator and
Yeah.
take care. So as the, do I take children the way do I do they do I do I do I look for somebody to help me and guide me into finding help to have better parenting.
Sorry to
So
interrupt you
all of
because
those.
interruption. Mhm. Okay. So you are saying that
Can you hear me?
parenting is in general. I'm saying according to the conclusion. I'm just drawing a conclusion from your discussion that parenting in general is a
Yeah.
challenging thing everywhere. So if
Yeah.
we come, because I'm
But,
from a different society and you're from a different society. We're from
correct.
our society is more like authoritative parents, and maybe your society type maybe assertive parent or a little bit those who give a lot of freedom to their children. So do you think excess of everything is bad, or these are two different extreme as well? That's why children are having issues with the parents. The parents are having issue with the parenting styles because we are too much rigid in our parenting style. We are not fluid. We don't give space to other people. We don't give space to even we don't want to learn the parenting as well. So do you think these are the challenging which we are facing nowadays?
So I do agree with your statements about different parenting styles from your side of the world and my side of the world. Definitely. At the end of the day, however, it is about being a balanced parent. So, balanced parent means giving time to the parenting, but also giving time of the anxiety and the stress of being a caregiver does not overwhelm you. Because,
Mm-hmm.
but you or anxiety, choose or you and for next whatever you need to be take care.
Thank you so much for your response. Okay, my next question is. What techniques will you use for the parent who have special need children? Because I know that the depression anxiety remains same in the sense that the symptoms sometimes they remain same, but their concern is little bit different because it's more kind of trauma like state they are living, and they are reliving that trauma all the time, and sometimes they're cursing themselves all the time. Let me give you some examples. What parent would say? First they will complain or they will blame their own self for their children. Like, I'm just giving a general example from the parents, which I hear from the parents, that we don't have time for the children. We both are doing the job, and the children is the caretaker. That's why they develop certain kind of state, certain kind of condition. Or even one parent told me that the couple told me that we don't like children. Mother don't like children. The father don't like children, and now God give them the children, and the child is with the challenge. Maybe the God is punishing us. So
Yeah.
on your countryside, do they have same kind of, you could say, challenges, or belief system is same, or it's different from our you could say from our culture side?
What I have noticed here, at least where I'm currently living, there are these programs you mentioned where so so there are definitely after there are behavioral that behavior behavior therapists and the school. So there are different sources that do not there so we here of aware to make sure, and in this case finding the right therapist to provide that extra support so that the parent
Okay, let me share what you could say the challenging parents face over here. Let me add a few more. For example, there
Yeah.
is some important thing, that is financial aspect. One thing
Right.
is financial aspect, and I'm sure financial aspect is also on your side as well. Okay, so second thing is that that is a very hectic job, because the parent have to train a child to different therapists at the same time. The child is going to school, maybe the mainstream school, maybe the special education center. Then the child is supposed to go to some doctor if he has some kind of issues like digestive problems or immunity system problem. So the child have to go to there as well. Then child have to go to the speech therapist, and the child is also have to go to the behavior therapist as well. So it's more kind of physical efforts as well. Then financial aspect is also there. So do you think these problems remain same at your area as well?
So it does, because sometimes it might fall through the cracks when follow up is not completed. But I am
Mm-hmm.
also aware that when therapists are 100% committed to their cases, it is
Mm-hmm.
likely to happen because we try to work in an integrated team approach. So if I
Yeah.
see that one of my parents is stressed out because maybe their child has not been diagnosed and then and let's say when colleagues of mine know that their child is as a parent that is in distress, maybe they provide their, which by the way makes me want to right now give a shout out to Angie and other colleagues. Um, little story behind this,
So this is a very
right,
common issue. This net is
with autism.
creating trouble for everyone. I told you today I
Right.
faced this trouble thrice and 2 and 4 times. So it's okay. We can understand the problem, and I'm very happy to connect with you and talking because it's not just about the topic. I'm also learning from you because I'm also a therapist. I'm also a psychotherapist as well. And my favorite therapist is, yeah, you could say, the one who I more like, I'm the more follower of the Jung. I really like his work because he talked about culture a lot. And I don't know who is your favorite one, but my favorite is called Gustav Jung, and I actually like his theory of this concepts of, the animus, the concept of mother and everything, and the symbolism in the religion. So he studies so deep, and that is the reality of nowadays as well, that we actually need to see, because a lot of things are collective. The concept of mother is collective, and when I connect other countryside, then I see that their problem is same just like our problem. So maybe the culture or the barrier, the space is not a barrier in our general problems, and the space between two countries is not the barrier, because child is everywhere a child, parents is everywhere a parent, and the nature of the problem could remain same as well. Maybe the finances is a different separate thing over here, or maybe at your side families are more like unit, a single family unit. Over here we may have a lot of joint family system. Even then people are facing such issues. Over here there are family are a single unit family as well, but I think situation are remain same at both areas. uh, According to your discussion, this is what I'm from getting from you. Okay, so what about those parents who don't consult you for their depression anxiety, or you could say their depression anxiety is you could say untouched? They don't want to talk about it, but you're going to tell them. What is your opinion about them, or what you're going to give them, you could say, a positive peace of mind to those people? Because you talk about positive psychology, you also look so positive,
Right.
and yes, sir,
So
sure.
it is definitely important to understand that even if they don't talk about it, and even if they don't verbalize it, their behavior and the way they act with those around them speaks for itself. So it is important to bring awareness, of course, to the issue of health, and being able to talk about it. That if I see my fellow parent not dealing so well with their role as a caregiver, I'm able to tell him or her, hey, I will recommend if you speak, or I will recommend if you speak. But even, I mean, even today we have so many options. I will recommend if you follow such a page on Instagram, or if you go to the website or read this blog, that this might be helpful to you. So that, like you
True.
we work on a system basis rather than an individual basis, and we're able to help each other, and by doing so, we reduce the stigma of mental health.
Okay. So thank you so much for giving the good response, and you are very much right that we have to support each other, and support system is very important because you know, in my practice what I feel is that we work a lot so hard, therapists work so hard on the patient, but you know what problem the came, the family members of the patient
Right.
are not that much understanding. Even somebody once a lady asked me a question that that was discussion about a family member who suffered a lot. She suffered for 15 years from some kind of trauma, and she was having anxiety and depression as well. So she took some treatment, and she's living her life so helpful. She's very happy in her life, but her mother is in trouble now. So her mother is in not was not in check. So I my point was there was that we have to take care of the family member as well, and family member need to take help from the therapist as well as collectively, because family therapy is very important. It's not about the individual. Family therapy is also very important because the whole family is suffering from that person, with that person, and you know it's more like a trauma, just like the trauma of war. You know that whenever you wake up with a certain people, and they will remain there, you cannot change your reality. You have to face that, and this is giving you, you know, uncertainty in your life. It's giving you panic attacks and stuff like that. So uh, I would like you to give them, the people, message that how they can uh, check their mental health by having a person in their home, so that they can, you know, they can be healthy as well. It's not about just about the patient, it's also about the caregiver and the family member as well. So what is your
Right, right. So
people?
so if the or client, are you listening to me? 'Cause I think
Yes sir,
it's
I can.
okay. Okay, perfect.
Okay,
So if
listen.
if the immediate client is an adult, one of the things that we work regarding anxiety is the fact of being okay with uncertainty. Because at
Okay.
the end of the day, yeah, we are a family system, but if I'm not doing okay with my so with the, it's being okay okay with what what if my child, what if my patient dies? And it would be the so communicate what if it's not work or to an extent, even if there is no support, we can still be able to still feel
Thank you so much for your response. Okay, my next question is that those children who have issues, for example, I mean, when they are their child as with the different needs, when they get adult, I mean, when they grow up, what is the difference, or what is their health, mental health challenges? How they face, or you could say, is it different? The challenges of a Did you hear my question, or should I repeat my question?
Yes, because the internet is not too well. So yes, please.
Okay. So my question is that there are two people. One is a person who have depression and anxiety, and there is other person who has depression and anxiety, but the person was with special or different need when he was a child. So what would be the difference in both people? The intensity of the problem, or how you will work with those both people? Because both have the challenges. I mean, situation is different now. So how you will work with these two people?
So it depends how much the anxiety and the depression affected them to our session. It's always important to, as part of providing the service, to also understand what level of anxiety and depression they have. And not only that, but also how much that depression and anxiety has affected their functioning. Are they able to work? Are they able to hold a relationship? Are they able to go to school, etc., etc.? And from there, we're able to differentiate what kind of treatment we're giving to the person who received help as a didn't. And while both cases are different, at the end of the day, what matters is that they come to the office to receive help, and that step is equally the same for both. Except for maybe the idea of being a bit scared, a bit anxious about telling our problems to somebody else that we don't know. But once you overcome those challenges,
Okay, thank you so much for your answer, and that is I actually agree with that. But I asked the question because we both are from different culture, and over here people think that only children have autism. Yet children with some certain condition, for example ADHD, and I am continuously advocating the point that adults have ADHD and adults have autism too. The problem don't fade away. When they grow up, they have depression, they have anxiety. Even if it's a girl, then she could have OCD condition. She could have with research they're showing that she could have eating disorder as well.
Right.
So the situation remains same. Maybe they had different challenges, or the thing was unchecked when they were childhood, but the problem will remain there, and they will have the anxiety and depression, and they have to go for the therapist even then after this therapy. So I don't know what is concept in your country, on your area, but over here people used to think, even in general parents are thinking, and they're all the time talking about, my child has autism, my child has autism, my child have this problem, my child has this problem. And I told them, okay, when they will grow up, what he will do with that people? Then their challenges will be different. So what is, do you in your country it's the same, or it's different aspect as well?
So
They don't think like that.
It is at times very similar. I myself, I'm from Colombia, which is in South America, and the mental health stigma is pretty high there. If you're going to receive help from a clinician, it's because you're either crazy or you couldn't handle it on your own and you're not strong enough. So here in the States, there is also stigma because it's also regarding, your cultural background, but education is increasing, the resources are increasing, especially now with technology. There are so many, I can count with like my two hands the amount of platforms are out there providing psychotherapy, coaching. So the stigma is reducing, but at the end of the day, we could have 1,000,000 resources, but if the family does not feel secure enough, or if they don't feel that mental health is important, they're not going to seek it. So the education of mental health has to be.
I would like to ask you one other question, because you talk about your own culture, and you said that there is still the stigma associated with mental health thing and taking help from the therapist. So do you see any kind of discrimination among the communities over there receiving mental health community, you could say mental health help from the therapist? Do you see any difference in the community or the therapist you approach toward those patients? I'm just taking your opinion from the perspective of other therapists as well, from both sides.
Regarding the stigma, I have many
Should I repeat my
clients
question?
that come to. I think you're talking about how do we deal with the stigma as a therapist? Yeah.
Should I repeat my question? Okay, let me repeat it again. I am saying that you talk about the assistant from the therapist. So, is there any difference between the culture or the community in your place or in your area that they are taking not appropriate help, and the discrimination facing? Are they facing any kind of discrimination from the therapist because they belong to certain culture, they belong to certain community, so they are not taking exact care of the person who will belong to their own community?
So something that is very important is, as part of our training, we need to be engaging in cultural sensitivity, and that is ongoing. So therapists, I think it is every 2 years, need to have new education on cultural sensitivity, because the idea of culture is changing every time. The idea of how we treated children many years ago, before we not even about to be in the most. So being educated about what is, is so it's both. So
Thank you so much for your time. You told me that you have only 45 minutes. I think our time is about to finish. Before going, I would like you to tell me about your own work, because I have seen your website, and the website is I like your website actually, because it's about positive mind. So how you're spreading the positivity? Like, you look like a very positive person, like an understanding person. But my point is how you're spreading the positivity through your therapeutic approach.
thank you. That is a very interesting question, and I think it begins with everyone and every interaction that we have. I'm very, very happy that you're doing this, and I
Thank you so
also become because of your own positivity and because you're doing it. Doesn't matter if it's on Sunday or nighttime, or we have, we're reaching 1 million people. Or the that there's, we're a community, and at the end of the day, we so that really is one, and my company is called Positive Thinking. I thank you for this, and I thank you for the education, that you started with. And let's tell how the education is stress and
much. Okay. Thank you so much for encouraging me. And I connected 10 to 15 people for that thing, and even lots of people just read my message. I will ask them again, can you please do it with me? Can you please do it with me? And two, three
right.
people say, okay, I will do it. Next time they would say, oh no, we are busy. Some say we are shifting. But you are the one who immediately get my idea, and two, three people are doing with me as well. But I was so happy that I just asked you to just request you to change the time, just because I did not even told you that I'm from certain region and we have some religious month is going on. Even then you give me time, and I'm so happy. I would like you to invite again with with my own Instagram feeds, with on my Facebook. And the thing is that what I can do is what I'm doing as being a mental health professional, that I'm doing a lot of, I'm posting a lot of stuff on my page, and I'm doing short version videos for the parents, for awareness, for giving them specific simple guidance about the problem they are facing when they have special needs children, what they could do, what is going on with them, because they all are taking therapists and their therapist is not are not giving them positive response about anything. Even they're not sharing the you could say the progressive approach of the child with the parent, the therapist. But like therapist supposed to tell the parents what the child is doing, what the child cannot do. They are not even giving enough time. Even the parents are paying a lot of money. I would say they're paying a lot of money to the therapist. They're doing their physical efforts. They're putting money in that. But I used to do. I used to go and I used to comment on Facebooks, on different pages of the Facebook, and my commented was deleted, and I was banned from the page, and I was out from the group. So sometimes it was disturbing for me that I'm not harming anyone. I just used to tell them the exact state of art, that what could be happened, what is the issue, where you need to go, what is the problem. According to my knowledge, my limited knowledge, that was what I was doing. When I when I faced such thing, then I just thought that I should do such things on my own page. So I just started making one video, and that there was my second video in which I was doing a small thing with a child. I was just teaching him emotion, and I just have 3 cards, smiley's face, and that hit like 2.5k view of that video. And people ask me a lot of questions that is a very basic thing, and you're doing this and you're doing that. Even then they hit. Then after that, it gave me a lot of strength. So I just started doing that. So even today, would you believe that today I did 4 sessions?
Wow.
Your one is 4th one. Yeah, I did 4 sessions. There was one child psychology training in the morning. That was almost 1.5 hour training. And then there was, I just took, there was an athlete in our area. She's facing a lot of hurdles. Then I asked her to, then I requested her to come to my platform and talk about her problem and how she's facing these problems. Then there was another one which got cancelled because of some reason, because of net reason. And the 4th one is yours. So I'm so happy to have you on my my Instagram stream, and I'm so happy you're doing so great work. I have seen your website, and it's all about positive.
Correct.
So positivity is, because there are a lot of problems in our society already. There's a lot of problem in our world as well. Poverty, money. We don't have money to buy our basic stuff. War is on our head. Political stuff is on our head. But what we could do, we could just make the people equipped how to come out. So that is our that is our little social work which we are doing. So I'm sure you will agree with this aspect of our work, and I'm really humble. I am really happy that you said that you will come to my stream. And again, I'm requesting you, whenever you have time, please come to my streams again. And is there anything you want to say at the end?
No, just invite everybody who's watching us either live or through the recorded session to continue supporting mental health, to continue supporting the message. Later. All right. So thank you. And great.
Thank you so much. I will again, I will again bother you. I will keep on bothering you. I just said this to some person, and what think mocked me at that time. I just told that person that I have certain condition, that I'm a neurodivergent person. So I tell that person this condition. So he said that you talk so fast, and you're giving a lot of information. So I told that person that this is something inbuilt, because I'm just mentioning my rapid talk because today I just faced this comment 4 times. So I said, okay, I'm talking and I will keep on talking. I could not do about anything about them, because I'm so passionate. I got so much in my mind, is keep a lot of things going in my mind, and I want to know a lot, and I want to learn a lot from everyone from whom I'm connected. And thank you so much. I'm saying thank you so much for coming, and I will keep bothering on you for again such live session. Thank you so much. Have a nice day.
Okay.
Bye.
Bye. Thank you.
Thank you.